And I am the outgoing Assistant Dean for Equity, Diversity, and Inclusion here at the Faculty of Medicine. And I'm here today with Dr. Rishi Kapur, who's the incoming Assistant Dean for EDI. And today we'll be speaking to you about discrimination, harassment, and intimidation. And so I'm not able to see if you have questions in the chat. If you do have questions as we go along, please do feel free to ask your questions. And as much as possible, we'll try to answer them as they go along. And Janine, if you wouldn't mind letting us know if there are questions in the chat, that would be really helpful, and we can pause and answer them as they come up.
Yeah, no problem.
Thank you. And so I like to start with land affirmation. And so this is a land affirmation for University of Ottawa. We pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region, from all nations across Canada, who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So land acknowledgements, as you know, are important for us to show respect for the Indigenous peoples who first inhabited the land and to help to educate people about the historical and ongoing impacts of colonization here in Canada. So before we start, I'd also like to acknowledge the opportunity, responsibility, and pleasure with which we endeavor to serve the children, youth, and families of the unceded territories of the Anishinaabe Algonquin people in this region, as we settlers have called Ottawa. So I'm a pediatrician and I'm also a parent, and my commitment is to learn about the history and culture of our Indigenous people and to incorporate this into my day-to-day life and practice. So I have no relevant conflicts of interest to disclose. And so this presentation is going to have 3 parts to it. So first, I'll give you a brief introduction to the EDI office and the concepts of equity, diversity, and inclusion. And then we'll review the definitions of discrimination, harassment, and intimidation to give you an idea of what constitutes these types of mistreatment. Thirdly, I'll talk about some of the impacts that discrimination, harassment, and intimidation can have on medical care, as well as on medical training. And finally, I'll outline the supports and resources that are available within our Faculty of Medicine so that you'll know who and how and where to turn to if you need help. So firstly, what is the EDI office and why do we have one here at the Faculty of Medicine? So in the EDI office, as you can see on the slide, our mandate is to raise awareness, encourage sensitivity, and to highlight pathways to improve equity issues in all aspects of medical school activity and the working environment for our students, residents, faculty, and support staff. So we work hard to create a culture that accepts and celebrates the diversity of all of our members so that all of us can participate in and benefit from opportunities to learn and to grow. So with respect to who is in the office, so we're very fortunate to have an excellent program manager and a program coordinator. So Ms. Kayla Hebert-Desnoyers is shown here in the picture, and her work is supported by Ms. Alexandra Lafrance, who also supports the EDI office. And then we have our Assistant Dean for EDI, Dr. Rishi Kapur, and our Vice Dean of Faculty Affairs, Dr. Sharon Whiting, who oversees the portfolios related to EDI, wellness, and professionalism. If you'd like to come and see us in the EDI office, or if you need to speak to members of the EDI office, they're located in Roger Guindon in room 3071, which is close to MedTech. With respect to contact information, you can contact us by phone, or you can reach out to the main EDI email at edifom@uottawa.ca, and we'll get back to you in a short time to address any concerns you have, or we'll set up an appointment for us to meet and discuss things further. So through the EDI office, there are a number of mentoring programs. So we have mentoring programs for different equity deserving groups, including a mentoring program for individuals who identify as sexual and gender minorities. We have a mentoring program for Black medical students and residents. We also have a postdoctoral fellows mentoring program, as well as a Kuwait mentoring program, which is run out of the international office, and an Indigenous student mentoring program, which is run out of the Indigenous program. So again, if you have questions about any of these mentoring programs, or if you see a group that is not represented and would like to have support in starting a mentoring program, you can reach out to our EDI office. So there's a number of education sessions and resources that we provide through the EDI office, including the EDI seminar series. So these are very informative and speak to different themes related to equity deserving groups, as well as different topics related to EDI. And so I encourage you to attend. These happen at least every other month. When it comes to curriculum development, we have tools for our faculty to minimize bias in their design of the curriculum. We also have workshops for unconscious bias, harassment and intimidation, as well as understanding bias, privilege, and allyship, and mitigating bias in education. And these are available to all of our members, including our residents, if you have interest in these areas. And they're all of no cost. So I've spoken about the office, but what is equity, diversity, and inclusion, and what does it mean to you? So in looking at the definition of equity, it's defined as equal access to opportunity for all. So it's the fair and respectful treatment of all people, and it involves the creation of opportunities and the reduction of disparities in opportunities and outcomes for diverse communities. So equity is something that can't be achieved overnight because it involves systemic and cultural changes towards acceptance, inclusion, and belonging. And the reason for this is that these are related to disparities that are rooted in historical and contemporary injustices and disadvantages. So it'll take a great deal of effort and culture shift for these inequities to be rectified. So you've probably seen different versions of this cartoon to portray the differences between inequality, equality, and equity. And this particular cartoon is based on the story, The Giving Tree, and it helps to provide a better understanding of the difference between these concepts. So looking at this image, we live in a world where the giving tree is crooked, and there's an unequal distribution of and access to resources and opportunities, which are portrayed by the apples in the tree. Equality will evenly distribute the same tools and supports, or the apples, to everyone, but it doesn't mean that access to opportunities will be the same. When we speak of equity, this implies that we give everyone the tools that they'll need to access opportunities and to reach their fullest potential. But really, the goal is to achieve social justice and to straighten the giving tree so that we'll have a just society that inherently provides equitable access to tools and opportunities for everyone. So what about diversity? So another definition here, where diversity is defined as the demographic mix of our community within the Faculty of Medicine, for instance, and it involves recognizing and respecting everyone's unique qualities and attributes, but it focuses particularly on underrepresented groups or equity deserving groups, including women, Indigenous peoples, visible and racialized minorities, persons with disabilities, and our LGBTQ2SA+ community. When you think about diversity, it's more than just a numeric representation, and it really means treating people with respect and dignity, valuing the differences and diversity of our faculty members, identifying and eliminating unfair and inappropriate behaviors and barriers, and making judgments that are based on equity and merit. Last but definitely not least is inclusion, and inclusion goes hand in hand with diversity. When we talk about an inclusive environment, it's one that'll ensure that all individuals are respected, valued, and heard, and that they'll all have an equal opportunity to contribute to the success of the institution. Inclusion means that we are intentional about creating standards and practices and actions that will promote engagement and empowerment, as well as a sense of belonging for all of our faculty members, so that everyone will have the opportunity to fully participate and everyone's talents are valued and celebrated. We all have a responsibility in creating a culture of inclusion. And so there's this concept of allyship, which is critical when thinking about equity, and it helps to facilitate equity, inclusion, and respect in medicine and in society. It's the result of a continuous and really intentional self-reflection to mitigate our biases and to advance the interests of others around us who have less privilege. When you look around you, your colleagues will come from a mosaic of differences, And being an ally will mean that you'll try to understand and respect that diversity. Allyship is about having someone's back. It means that you're actively advocating, supporting, and being a voice for those whose voices aren't being heard. And as an ally, this means that you're not being a bystander, but an upstander. So it's active, and an ally will recognize the privilege that they receive from society and use an aspect of their own privilege to help someone who's being harmed. In our Faculty of Medicine, we really strive to create an environment of inclusive excellence. So this means that we set high standards for professionalism so that you, our learners, as well as all of our faculty and staff will be able to thrive within an atmosphere that's positive and that has respect, engagement, and support. We have a zero tolerance for mistreatment of any form, but really our faculty can only act if inappropriate behaviors are reported back to the medical school. So we have resources that we hope that you'll take advantage of so that if you do experience mistreatment, you can help us to dismantle a culture that would enable that type of treatment. So you may or may not be aware of the Be in the Know website. And this is actually a page on the UGMU website that provides all of our learners with necessary information to be in the know when it comes to mistreatment in medicine. So in spite of our best intentions, there may be times when we could experience unwelcome or harmful words or actions. And this Be in the Know website will provide direction and resources about where to find University of Ottawa policies, how to know the difference between what is teaching versus mistreatment, as well as where to get help, the steps you can take for reporting, and what steps will follow in the process for dealing with mistreatment in the medical school. If you're in doubt, though, you can always reach out to the EDI office for support, and we'll help to direct you to the right resources while protecting your confidentiality. So what is discrimination? So when we speak about discrimination, this is more than having prejudiced thoughts or using prejudiced language, but it's actually an active denial of opportunity or a differential and unfavorable treatment of a person or group of people because they're perceived to belong to a certain category of people. So having an environment where discrimination would be allowed or tolerated would be in an environment where people are deprived from freely exercising their full potential for themselves or for society. When we talk about discrimination, we're referring to specific characteristics known as protected grounds. And so protected grounds will define a group of people who share a common characteristic, and they are legally protected from discrimination based on that characteristic. So here on the slide, there's a list of different protected grounds based on the Canadian Human Rights Act, and differential or unfavorable treatment based on any of these characteristics would be considered discriminatory under this act. These grounds can vary somewhat from province to province, but generally they tend to center on these themes that are shown. In general, when we talk about discrimination, this is something that can operate at different levels, whether individual, interpersonal, or systemic levels of society. And these levels interact to both create and limit power and opportunity between socially constructed groups within a society. So for the purpose of this session today, we'll focus on the individual and interpersonal levels of discrimination that can unfortunately occur during our everyday interactions. At an individual level, one's beliefs or actions will actually create a storyline based on one's experiences. And this storyline could be conscious or it could be unconscious, where you don't even recognize that it's influencing your behaviors. This storyline can also be externalized, where you're directing it towards others, or internalized, where you have self-perpetuation of oppression. Without a conscious effort to overcome our own biases, this storyline will dictate the way that we deliver and receive clinical care, and also with the way that we identify with society. And so this comes from our inherited or our inherent rather tendencies to categorize people as friend or foe. And this can be something that's completely unconscious, or it can be conscious. At an interpersonal level, bias and discrimination will shape our interactions with other people, and it'll dictate how we treat people who are similar to us and how we interact with those who are different. In talking about different types of discrimination, there are a few examples here that may be more overt, such as stereotypical comments, where, for example, in certain medical fields like nursing, there are generalizations where there are sentiments where one gender may be more suited for one area versus another. Another example would be insults related to a person's social identity. So, for example, expression of derogatory comments based on an individual's sexual orientation. Other examples could be structural or systemic. For example, differences in educational opportunities. For example, women not having the same learning or clinical opportunities as men who may be in the same team, or vice versa. Discrimination may also be embedded in legislation. For example, religious-based discrimination with Bill 21 in Quebec, which prevented public service workers from wearing religious symbols while performing their civic duties. And so I'll just pause there. It's a lot of information, so I'll just pause to see if there are any questions, and then we can go through a case together. And Rishi, if you have any comments, please feel free to jump in.
I don't have any questions in the chat box just yet, but we can wait a moment if you like.
Okay. Okay, thank you. And so that's fine. So we can start working through this case example together. Oh, Victoria has her hand up.
Hi, sorry. I was really interested in hearing about like the mentorship programs. I was just wondering if there's been any talks about starting a program for like neurodiverse folks, so people with ADHD and autism.
So that's a really great suggestion. So thank you for bringing that forward. So up to now, there has been some discussion about starting a mentoring group for physicians and learners who identify as having disabilities. And this was a very broad umbrella, but we haven't specifically spoken about individuals who identify as having neurodiversity. And I think it's a great suggestion. So if it's something that you have interest in, or if you know of others who have interest, I would encourage you to reach out to the EDI office, and we can at least talk about setting up a framework to try to establish a group for that.
Absolutely. Thank you.
Thanks for that suggestion.
What I would add to that is the wellness office has also been thinking about similar type, whether it be interventions or supports for learners who might identify as neurodiverse. So if anyone has thoughts about what they would want or what they would feel would be useful from a learner perspective, feel free to forward that to wellness as well.
Okay, great.
Yeah,
thank you.
Absolutely. Thank you.
Okay, that's great. Thank you for that. Any other questions or comments? Okay, great. So then why don't we start with the case? So I can read it out, but I'll give you all a few minutes to digest it. So the hospital is looking for resident representatives for a high-profile national committee. This would be a great networking opportunity. There's a group of you discussing the topic when Dr. Smith, a white male colleague of yours, says to Dr. Walker, a Black female colleague, "You should definitely apply. Given the current focus on diversity, you would be a shoo-in. I, on the other hand, wouldn't stand a chance of being selected." So I'll just give you a few minutes to think about that. And so I have a couple of questions here, but you can also feel free to give your comments. So in this case, was there discrimination? And if so, can you put a label on it to say what type of discrimination took place? Okay, Obey, please go ahead.
Okay, so I believe that this is called positive discrimination, in which in such cases where people who are thought to be belonging to a certain minority would receive more advantage over others just because of their
Oh, sorry, your microphone muted.
Oh yeah, and that happens often sometimes with yeah, people who are like people who belong to certain minorities would get certain chances sometimes, and that's called positive discrimination. At the end of the day, it's a form of discrimination.
Okay. Okay, thank you for that comment. So when you're talking about positive discrimination, I think you're also referring to something we also call affirmative action. Is that what you're referring to? Does that sound
I'm not
correct?
sure, but I'm not sure if it's the same, but what I know is like positive discrimination is an issue. I'm not aware of it in Canada. I'm aware of it more in France, and that's how I learned about it. But yeah.
I see. Okay, all right. Well, thank you for sharing that. And then before I comment on that, I saw another hand raised. I can't see who it is though. Sarah, please go ahead.
Hi, yes, thank you. I think at first I also thought of positive discrimination, but I think that's what the other guy thinks, like the white man thinks it will be positive discrimination since she will most likely get the job according to him. But the fact is different because we didn't actually see her get the job instead of him, so it's difficult to prove. I think in this case, it's discrimination against the Black woman because he assumed that she has an advantage against him. So it's kind of like it's kind of creating an environment of tension and differences in colleagues, and I think it's like not good. I don't know how to explain it. It's just uncomfortable that he would put her in that situation.
Okay, all right. Okay, thank you for those thoughts. And I see that in the chat, Victoria said that her understanding is that affirmative action is often cited as a scapegoat for positive discrimination. For example, of course, you did well in X because you are Y. Okay, thank you. And are there other comments before I say anything more? Okay.
Can you hear me?
Go ahead, yes.
Yes, I felt that the comment of the colleague kind of implies that there is no other reason that this woman could like be accepted other than like her skin color or being like a minority. I'm sorry, I'm trying to explain my thoughts, but like he could have said like, oh, I think you have the skills to do that, you're like you would be a great person in that post, but instead of that he just referred like the chance that she's having is because of her ethnicity and like the diversity of, and not because of her skills. So it kind of is a discrimination of not recognizing that she could have the post, like she could be like she could have the skills required for that.
Right. Yeah. Thank you so much for those comments. Yeah. And so there are a lot of assumptions I think that were made there. Yeah. But thank you for that comment. And then Victoria, please go ahead.
Yeah, I completely agree with Chloe. And I think like the term tokenism definitely comes to mind, like the idea of like you are your race, and like that's the only reason that people would want you to be as a part of this, as like a token to represent that, and like completely, just like Chloe said, kind of dismissing all of the other things that make that person who they are.
Right. Yeah. Thank you for that comment. And so, yeah, so a lot of really good comments that have been made. And so, starting with, the question about positive discrimination, it's possible that, there are programs that exist where there may be recruitment for individuals from a certain social group or individuals with certain social identities, but there was no mention of that in this case. And it seems that there were a few assumptions. Firstly, that Dr. Walker would even be interested in this position, or that that was the only reason why she would be suitable for the position, as has been mentioned, because we don't know anything about her interests or her skills or what skills are required for this committee. And And then also the flip side too is that her colleague also made the comment that because he's white, he has no chance. So that also implies that the selection is based only on her ethnicity or her race. So it's a lot of assumptions that have been made in this particular STEM. And so in terms of the type of discrimination, it's possible that there may be some type of affirmative action or positive discrimination with the selection process, but it wasn't really clear in this particular case. So I think that it was an assumption perhaps that was made by one of the residents here. But I don't know if there are any other thoughts or questions. And yeah, Dr. Kapur, feel free to jump in too.
Yeah, I was just going to add, kind of, you also, when we're talking about equity and power imbalances, you have in this circumstance the white male who's starting a commentary towards a Black female with all the assumptions you were describing. And I think, there was implications in that he was going to be undervalued. And to some degree, like, how would he be in a position of less power, or be threatened by that process, right? Which I think is important to note as well.
Absolutely. Yeah, thank you for that. And then it looks like we have another comment in the chat. Right, yes. So overall, a weird thought to voice out loud. Yeah, and it's interesting because sometimes, when things are said out loud, perhaps the impact is not recognized, right? That it may land in a way that could be offensive, or it may land in a way that can be harmful. And who knows, with this particular case, he may not have intended to be hurtful or harmful. He was just actually thinking about something that he's worried about, or something that he has been led to believe and led to his biases, right? And sometimes these utterances happen in spite of our best intentions. And so that leads me to the next slide. It's a good segue, where the type of the discrimination in this case is that this is an example of something we call a microaggression. And so I don't know if it's a term that you're all familiar with, but microaggressions, here's the definition. So these can be everyday verbal, behavioral, or environmental slights. And it doesn't matter if it's intentional or not, because they communicate the sentiment that's hostile, derogatory, or negative towards a group that's stigmatized or culturally marginalized. And so when we talk about microaggressions, they can be on the basis of any social identity. So it could be based on race, could be based on your income, your social capital, your religion, sexual orientation, basically any identifying characteristic. And when we break it down, there are different types of microaggressions, where we have 3 categories: micro insults, micro assaults, and micro invalidations. And so I'll go through these in a bit more detail. So firstly, when you talk about micro insults, these are microaggressions that are often unconscious, and they lead to demeaning comments or demeaning insinuations about a person's social identity or their heritage. So here are some examples. So on the top, a woman who happens to wear a hijab, and she's asked, "You were born in Canada?" And then for the individual beside her, there are questions about their mental disability because they appear perfectly normal. Okay. And then at the bottom, you have a woman who's assumed to be a nurse, another woman who looks like she may be of East Asian descent, who's asked if she speaks English, and then a man who's being asked if there are any doctors from America who could see them. So another example would be, did you get your job through affirmative action? So thinking about this case that we just listened to, or one that I've actually heard myself, your people must be so proud because there's so few of you in medicine.
And something I would add, like, you know, a lot of these examples are are quite overt. Like, even if they might not be intentional, they're overt. I can think of microaggressions that are less overt, where, you know, and this has happened to me in the last 2-3 years, where I would be on a Zoom call and someone would ask me a private question actually intended for the other brown person on the call.
Oh no.
And that's one example where, like, it was, or where I've been misnamed the other, you know, the other South Asian physician in our group. So those are not, like, as, you know, you could seem completely innocuous, but could still have an impact on individuals, right? So it's helpful to be thinking, you know, even about things that might be a bit less apparent.
Yeah, thank you for sharing that. Yeah, and those resonate definitely. And so another type of microaggression is what we call micro assaults, where it's intentional. And so these are often explicit verbal or nonverbal attacks that are meant to be hurtful. So they can be through name calling, avoidant behavior, or being purposefully discriminatory. So to give some examples, so in 2019, President Trump posted many inflammatory tweets, including these ones where he called on Democratic Congresswomen, Representatives Alexandria Ocasio-Cortez, Ilhan Omar, Rashida Tlaib, and Ayanna Pressley to go back to where they came from, even though most, if not all of them, were born in the United States. And Trump actually went on to call on these women to apologize and allege that they hate America because they were women of color. So again, very overt examples. And with microassaults, that tends to be the case because they're intentional and conscious in their intent. And so the last category is what we call micro invalidations. And so these are comments or behaviors that tend to minimize or deny the experience of someone who comes from an underrepresented group or community. And these are often done unconsciously. So here are some examples. So firstly, the All Lives Matter slogan was associated with a rejection of the ideas supported by those who were proponents of the Black Lives Matter movement. And it's basically equivalent to saying that there's no problem with Black lives. Other statements here are similar. You don't look disabled. Saying I don't see color is not saying that you're accepting or that you're open-minded, but rather that you're denying a person's experience. You don't seem like you grew up poor. She's a great woman scientist. It must be nice to be a stay-at-home dad. So all of these statements completely disregard the experience of the individuals that they're being directed toward. And so, as you can tell, microaggressions can be hard to conceptualize because sometimes they don't actually seem aggressive. And so in thinking about microaggressions, another term that you may have heard is subtle acts of exclusion. But the bottom line is that these statements and behaviors are harmful and serve to reinforce existing privilege, and they undermine a culture of inclusion. So they can seem harmless or annoying, but they actually cause very negative outcomes when it comes to health. So for example, when thinking about our work and clinical environments, it's been shown clearly that microaggressions can have a negative impact on mental health. For individuals who experience microaggressions, you don't feel safe in that environment where people are allowed to say things that are harmful towards you. This can lead to chronic stress. Some individuals will have physical symptoms. You don't feel like you belong. And it can actually translate into poor performance because you lack confidence in your ability. And if you're not performing well or motivated to stay in an unsafe environment, you're more likely to quit and to drop out. Within the clinical environment, when we're talking about patient relationships, microaggressions will undermine the trust that patients from underrepresented communities will have towards their providers. And as a result, it's been shown that individuals who have conditions that are treatable may actually opt out of healthcare and end up with prolonged and needless disability that isn't being treated. So the bottom line is that with microaggressions, if we don't address them, they become part of our culture. So if we allow them to be present, it's like we're saying that we're okay, they're okay, or that we're okay with them. And in doing so, this will perpetuate the biases in our everyday interactions. So Dr. Kapur shared some experiences with microaggressions that were less overt. I shared an experience. And so I just want everybody to just take a moment to think about it and whether or not you have actually experienced microaggressions and what impacts they had on you. So Sarah, thank you. Go ahead.
Actually, yeah, when Dr. Kapur mentioned his microaggression, I thought of the same thing that happened to me in Quebec, where in my first rotation in clerkship, I had not teachers, like professors, preceptors, always addressing me as the name of the other girl that was from Morocco, and I'm from Algeria, so we look a bit similar. And they always said her name, which was Salma, instead of mine, which was Sarah. And even if I corrected them the entire time, they still addressed me as her name and vice versa. And it even reflected in the final evaluation where she was a very reserved person and very sweet, very, very nice. She was still a wonderful student, so I didn't mind. But still, as I'm more outgoing, so in my evaluation, it said that I was reserved, so I could tell that they were speaking about her. Yeah.
Oh my gosh. Thank you for sharing that. That must have been so frustrating for students. Yeah. Yeah, that it even came out in your evaluation is really, really frustrating. Yeah, I'm sorry about that. And thank you for sharing. Yeah, for me, I have a difficult first name. So I know the importance of, having your name said correctly, but also, of course, being called the right name. So I can imagine how challenging that is. And also with positions of power, like when it's your supervisor, it's not always easy to speak up and correct the behavior.
Mm-hmm. Thank you.
Thank you, Sarah. And then I see Obey has their hand up.
Yeah, I was thinking also of another form of microaggression because since moving to Ottawa, I've experienced that in total 3 times. 2 of them were at the University of Ottawa, or and the affiliated hospitals, and it usually comes from it's the same profile of persons that will not describe, not to sound racist, but it's usually that when you ask about something, sorry, that's my dog. When you ask about something, they would say, oh, we usually don't do it this way, or oh, this is how we have been doing it for tens of years and nothing wrong happened. And I find that is quite problematic because first, it does not validate how I'm feeling about what is being done. And 2, it would be like, oh, he's a man of color who has piercings, looks someone who belongs to the LGBTQ community, and I'm superior when whatever I am. And then, okay, I will not validate how he does. And I'm just gonna give him any answer, which is, oh, this is how we do it. This is the way, our way, and that's the highway. So I find that also microaggressive.
Okay. Yeah, very dismissive, right? Of the person's knowledge and
Very
experience.
disrespectful, and it reflects also inability of this person to be flexible.
Okay. Right. Yeah. Thank you for sharing. And yeah, because, one thing that's really important in mitigating bias is trying to be able to see from other people's perspectives, right? And we all have different experiences. So yeah, what you described does definitely sound like even a I don't know, we'd say invalidation if we were to say it was a microaggression, but it does sound very harmful. But thank you for sharing. And I see Victoria has her hand up as well.
Yes, I'm really glad that we're learning a lot of these terms because, like just like you said, like a lot of microaggressions aren't aggressive, and especially I think as women, we spend our whole lives gaslighting ourselves, saying that our emotions and reactions are are too much, and oh no, they didn't mean to do that. For me, and this is took a long time to identify this because it's from I think all our teachers are very well-meaning, especially anyone that even bothers to teach, and so I don't want this to be misappreciation of that. But I'm very open about having executive dysfunction and struggling with things like organizing things for documentation and presentations. And I'm always very happy to take tips and how to improve on things. But it's really difficult when teachers don't ask first of like, what have you tried? And like, why do you have such a complex system? Because the amount of hours I've been forced to listen to really well-meaning teachers say things like, I use a list. Or you could copy what's in this tab into this tab so you can close the one tab. Only to say, like, I really appreciate that, but I have tried that, which is why I now have 4 separate applications. And this is what allows me to function at the level that I do. So I guess like that goes for like patients or future students too, is just like always make sure you ask where they are and what they've tried and where they come from, and always try to like assume that they put in effort and also just like the highest ability, because I think that's, to say the very least, of a micro invalidation of the fact that I don't function the same as a lot of people and need extra support in those ways.
Thank you so much for being so open and sharing that. And I think it's really important, you know, as a teacher myself, you know, to hear that. And I think we do have the tendency to try to make somebody else's experience our own, right? Because that's what we know, but that's not necessarily, firstly, the best thing, but also you're not hearing the person who's talking to you and asking you for support if you try to make their experience into something else. So that's really, really helpful. So thank you.
Yeah, and that's obviously on student. There's also a huge power imbalance, but I have learned to like communicate better and try to make my questions more specific, and also like not fawning as much, because I used to just listen to these kind of useless tips with like doe eyes, like, oh, thank you so much for teaching. And I don't think that was helpful, because I think it is obviously teachers want to think that they understand what your specific hardship and problem is, and so that's why they're offering the advice. It's just, yeah, it's hard to not be validated when I say that, you know, I have different problems and you might not have the answers, and that's okay. Yeah.
Yeah, thank you so much, Victoria. Thank you. And so I don't know if there are any other comments, or Dr. Kapur, I don't know if you had something you wanted to add as well, or no? Okay, thank you all for sharing. Okay, thank you. And thank you all for sharing, because clearly microaggressions are something that are very present in our everyday culture. So it's really important to acknowledge that we may commit them ourselves, right? Because the intent doesn't matter. It's the way that these comments and behaviors are received. So it's really important to take a step back and reflect, especially if someone is telling us that our words or actions have been harmful to them. And so, oh, I see something in the chat. Okay, thank you, Elena. I think another microaggression that I've frequently seen in our healthcare system is assumption of pronouns. Thank you for that. Yeah. And assumptions of trans and non-binary individuals as being dramatic. It's very sad to see and often excused as ignorance. Yeah, and so thank you for that. That's a very important example. And I think that we do need to make more efforts to educate our learners and providers and teachers about the importance of not misgendering individuals and asking individuals what their preferred pronouns are, and even understanding why it's important to be able to identify with certain pronouns. Like, I think this is something that's really important. Thank you. And I see Dr. Kapur unmuted.
I was going to say, and I would add like how that's incorporated into medical documentation, right? Because there can be a lot of inconsistency and lack of effort to, you know, to be clear or correct or consistent, if that makes sense.
Yeah, absolutely true. And I speaking about CHEO, I know it's something that we're also trying to, that we've talked about in our hematology oncology division as something that we want to try to address, because it's something we don't do very well, for sure. And so in coming back to the case, now that we can name, yes, now that we can name different types of microaggressions, is there a label that you give for what happened with Dr. Walker when she was told she should apply for this position?
So I see elements of a micro-invalidation just in, oh, and so does Sarah.
Mhm.
Sarah, do you want to speak to that?
Sure, thanks. So I see that I don't think it was a micro insult specifically, but when I saw micro invalidation, like communications that exclude or negate or nullify the psychological thoughts, feelings, or experiential reality of an underrepresented person, I feel like it was more of that, especially how Chloe and Victoria mentioned it. It's how he didn't think that she was qualified because of like her experience or her qualifications. It was strictly because of her race. So he's like invalidating everything she's done, and that's not cool.
Yeah, thank you. No, I think, yeah, those things all hold true in terms of, not acknowledging the fact that she could be qualified, invalidating the fact that, her Blackness may come with negative discrimination, for example. And I see in the chat, though, we do see some variations in answers. And I don't think there's a right or wrong answer, to be honest, because there could also be some element of micro insult because we don't know the intent of the individual who had expressed this towards her. And then, but I see micro invalidation has come up a couple of times. Victoria, go ahead.
Sorry, I'm talking a lot today.
No, it's
But
okay.
I think one other element of like, and related to like tokenism, is also the fact that this doctor is inadvertently placing the burden of advocacy onto a minority. And like, I feel like it's important because advocacy has to stem from abundance, right? And I feel like it's really difficult when people who are like in oppressed groups are expected to be the ones to also advocate for themselves. And so like, I don't really know what that's called, but just to consider that it's not probably good to do that to people.
Yeah, thank you. Yeah, thank you. It's the opposite of allyship, right? You're pushing that person to step out of their position of being underprivileged to advocate rather than using one's privilege. So I also don't know if there's a term for that, but it's really an interesting, important point though. So thanks for sharing. And so, yeah, so depending on the perspective you take, I think that this could be labeled as micro invalidations, micro insults. If we knew that the person was trying to be hurtful, perhaps micro assaults, but less so because it doesn't seem to be violent in its nature when we think about the words that he used. Okay, great. And then, okay, so now that we've defined things and we know what's happening, what can we do? So for Dr. Walker, if you were Dr. Walker and you were in this situation, what would you do? And then if you were not involved, but you were her colleague and overheard this interaction, are there things you could do or say? Obey, thank you. Please go ahead.
So for A, I am not sure, so I'm gonna imagine myself Dr. Walker, but if I'm a bystander and I overhear the conversation, if I'm close enough to both, I would reach out to both of them separately, and I'll see how Dr. Walker felt about that. And I'll also maybe reach out to the other physician and I'll talk to them, understand more why they said that, and share with them that my thought or observation that this is not really acceptable and is a kind of discrimination and aggression against Dr. Walker. Just in
Okay.
a friendly manner.
Okay. Thank you for that. And yeah, so I think it's important to check on your colleague, Dr. Walker, make sure she's okay, but also to talk to the colleague who made the comments. Yeah, so thank you for that. Not always easy to do. And then Victoria has a quote here. What are the factors that make you feel so unqualified? And how do you think you can improve on those that are modifiable? Okay, thank you, bye. Okay, but yeah, you can ask, it's true, you can ask your colleague why he's feeling that he wouldn't be qualified. So this is something that Dr. Walker could say in response, you know, trying to understand where he's coming from, trying to understand why he has that perspective. And that reframing can sometimes make a person more aware of the harm that their words are inflicting. But any other thoughts?
I think for me, if you are Dr. Walker, yeah, I think I would tell him like, oh, like I would try to still to understand his point of view, like what made him feel or what made him have the need to address this to me. And I think it's more because he feels discriminated himself. He thinks he's being put in a position of not being not I don't know, like he doesn't have the opportunity. Like I would try to explore what he feels and then try to reassure him and tell him I think you have an equal opportunity or more than me to be able to get any position you want. But I would still try to explain how I didn't like his comment because I think it's a microaggression. Yeah.
Okay, all right, thank you. Yeah, so your response serves a few purposes, right? Because he might have his own insecurities, he might be feeling bad for whatever reason that he doesn't think that he's qualified. So exploring that is supporting him in a way, but also stating why these statements make you feel hurt or uncomfortable, I think is really important. And so I think that sounds like a great response as well. And so thank you all for sharing those. I don't know if Dr. Kapur had something to add, but I wanted to take you through a few ways to respond to microaggression, because it's often not an easy thing to do, especially when there's a power differential. So for example, say that Dr. Walker was talking to her chief resident, and the chief resident is the person who said this to her, or if it was her supervising faculty during her rotation in the elective specialty that she wanted to match to. You know, it's not always very straightforward, being able to respond to these microaggressions, and sometimes really uncomfortable.
I'll just quickly add, you know, I also see a lot of value of meeting with Dr. Walker to actually see how she felt with that encounter and label it that what I saw, you know, being on the outside. Because sometimes I think with microaggressions, people don't always necessarily, like, they might gaslight themselves. So they might second guess, did that actually happen? Was it like, I feel uncomfortable, but I don't know why I feel uncomfortable? So having somebody else, you know, acknowledge that as a peer can be valuable. And you know, there might be a sense of, has this happened more than once? Is it a one-time thing? Like, you know, so that they can feel like there's a sense of collective community, or that, you know, that you're there for support.
Yeah, for sure. Thanks so much. No, that's so important. And so I have a bit of a framework that I want to go through, but firstly, I wanted to start with some of the common responses to microaggressions, which are usually to ignore them, pretend that they didn't happen. Microaggressions can be very awkward and uncomfortable, and often we don't know what to do or say in the moment, right? Sometimes you brush it off. You can say, oh, you know, they didn't mean it, wasn't intentional, so maybe I should just let it go. That gaslighting that Dr. Kapur is also mentioning, you know, leads us to do that. And also sometimes we just don't want to rock the boat. Maybe we can just move on and everything will be fine. What about this one? Let's always assume positive intent, even though the words were hurtful, because positive intent carries more weight than the words and the pain that they cause. So really, if it's causing harm or discomfort, it's something that warrants response. And so sometimes that's not easy to do. So hopefully the next slides will be helpful. But in reality, most of the time we don't do anything at all when we have experiences with microaggressions, because accept them as being part of the culture. And unfortunately in medicine, this happens more often than it should, where sometimes we just feel that, oh, you know what? Medicine's tough. My previous generation, my mentors, they had to go through these tough situations and navigate these tough behaviors. And so that's just part of being a doctor. So really, when it comes to microaggressions, we really should focus on the harm that's been committed and how to make it right. In this image, this person didn't mean to drive over this person's foot with their car, but that doesn't mean that it doesn't matter, right? His foot's broken, he's in pain. We need to address that. We can't walk away and ignore it. And microaggressions are no different, where the intent is not as important as the impact of the microaggression. And because there's significant impact, they should be responded to. So when we think about the best responses to microaggressions, they're responses that should help to increase awareness about what microaggressions are. They insist that individuals should stop committing them, and they also help to call people out when they commit microaggressions. And so this sounds great, it's easy enough to say, but really, how do we do this without putting ourselves at risk? So depending on the situation, you'll ask yourself, should I respond now? Should I respond later? Or should I let it go? And depending on the circumstances, any one of these responses may be appropriate. However, let it go is really not usually the ideal response. But in the next few slides, I have a framework that I find helpful, and it actually came from a paper I read called When and How to Respond to Microaggressions. And this was published in the Harvard Business Review in 2020. And it's a framework that really helps to determine which course is best in any given situation. And then it also gives you a dialogue that you can use if you decide to respond. So it's structured to help a victim or a bystander to discern, disarm, defy, and then decide how to respond to a microaggression. So in talking about the first step to discern, this talks about reflecting on the situation to discern if you should respond to a microaggression. So some questions that you can ask yourself to help you to discern if you should respond or not relate to how important the issue is related to the microaggression, how important that relationship is between you and the aggressor, how you feel, and then how you want to be perceived in the moment, but then later on, because there will be consequences to speaking up. And they could be positive if the person doesn't do this again in the future. And there could be consequences to remaining silent. And so ideally, you would want to come out with positive consequences, but it's possible that it could have an impact on the relationship you have. But depending on how important the issue is to you, it's only you who can determine what is more important in any given situation when it comes to responding or not. So then the next step is to disarm the perpetrator by using phrases to invite them to sit alongside you with that awkwardness of their words, while at the same time you try to get to the root of the behavior together. So this has to do with reframing and reflecting their straight statements back to them. So how can you do this? So you can try to acknowledge the feelings behind the statement. So for example, you can say things like, it sounds like you're really frustrated. I can understand that you're upset when you feel this way, trying to invite the person to think about the statement, but also acknowledging that they may have feelings that led them to say that. You can also express your feelings. For example, you can say, when you touch my hair, I feel really uncomfortable. You can share your own process. You can say something like, I noticed that you always touch Black women's hair. I used to do that too, but then I learned that it's actually something that's not very appreciated. Another way to disarm them is by using humor. So you can exaggerate their comment. You can use gentle sarcasm. For example, she plays like a girl. You mean she plays like Serena Williams, or she plays like Mia Hamm if it's soccer. You can also try to promote empathy. So for example, you can ask someone how they would feel if someone said a similar comment or made a similar statement in relation to their family member, their partner, or them directly. So the next step is to defy or to challenge the perpetrator by pushing them to clarify their statement or action. And you can do this by using probing questions. For example, what do you mean by that? Or why do you say that? Make them think about what they said. And this gives them a chance to check themselves as they unpack what they said or what they did. And it also gives you an opportunity to gauge their intent and to see things from their perspective. So the truth is, as people try to explain their comments, sometimes they can recognize how awkward or silly they sound. So ways you can do this are by pretending you don't understand. You can say things like, I don't get why that's funny, or why are you laughing? Or you can ask them for clarification or more information. For example, you can ask, how did you come to think that way? Or could you say a bit more about what you mean by that? You can also try to appeal to the person's values and principles if you know them well enough. So you can say something like, I know you care a lot about equity, but really acting in this way undermines those intentions and actually leads to inequity. You can also try to point out what the perpetrator has in common with the other person. So for example, I'm tired of hearing your Christian jokes. Do you know he's also studying music and likes to dance? You may want to talk to him about that instead, because you actually have a lot in common. But sometimes you just have to remind people of the rules or policies. And you can be very direct and just tell someone that that behavior is against the code of conduct and can get them into trouble. It's really important, though, that with this defy step, you try to avoid why questions, because you don't want the person to become defensive, right? And that defeats the whole purpose of trying to challenge them in their statements. So finally, you should decide what this incident will mean for you and your life and your work and what you'll take from the interaction, but also what you'll allow the interaction to take away from you. So in responding to microaggressions as a target or as an ally, this is a way that you can protect your own well-being without allowing these microaggressions to bring you down. So hopefully this is helpful. You don't have to remember every single statement or every single type of question when it comes to this discern, disarm, defy, decide approach, but simply trying to reframe a person's statement or behavior in a way that makes them think about it can often uncover a person's intent and also make it clear that these microaggressions are harmful and not acceptable. And so coming back to the questions, you can use this framework in trying to decide what Dr. Walker could say or do, but also as a bystander, how you can be an ally rather than a bystander, so an upstander in trying to help Dr. Walker to respond in this situation, but also to support her through the harm that it can cause. So I don't know if there are any other thoughts before we move on to the next slide. Okay. So now I'm going to talk a little bit more about harassment and intimidation now that we've talked about discrimination. So harassment is defined as engaging in a course of vexatious, annoying, or provoking comment or conduct, which is known or ought reasonably to be known to be unwelcome. So in this definition, the most important term is the term unwelcome, because we don't have the right to impose our words or actions on someone else if they're unwanted. And so again, this is something that's subjective, just as with microaggressions. It doesn't matter if harassment is committed intentionally or unintentionally, and it depends on the perception of the victim. So when we talk about harassment in educational settings, this is a serious and unacceptable behavior because it interferes with your education. It will make you feel unsafe, and as a result, it'll prevent you from reaching your full potential. So when we talk about intimidation, by definition, there's a power differential where one person is using their authority to inappropriately influence behaviors. So this can be verbal, nonverbal, it can be physical, and it could be psychological. And so when we talk about the medical education environment, most instances related to bullying or intimidation are committed by someone who has authority over the victim. So for example, a faculty member relative to a resident, a senior resident relative to a more junior resident, a resident to a student, and so on. And so when we talk about intimidation, this is something that will poison the learning environment, and it contributes to an environment where there's low morale, where there's fear of retribution or bullying, but where there could even be feelings of anger or depression experienced by the victim. So here are some examples of harassment or intimidation, and these are more overt. For example, racist jokes or banter or insinuations, inappropriate questions about a person's physical disability, social exclusion because of one's social identity, sexual solicitation or having a sexual relationship where there's a perceived abuse of power, by definition, is considered as sexual harassment. Forwarding or viewing emails or images that are perceived to be unprofessional, inappropriate touching, and spreading rumors about a person's sexual behavior or about their social identity in general can be constituted as, or can constitute harassment or intimidation. So these are overt examples, but sometimes harassment and intimidation can be more subtle. So for example, the manipulative bully. So your senior resident on your rotation tells you, you're the best resident that I've ever had the pleasure to work with. I only give you this extra work because I know you can handle it and you'll complete it without complaining. What about being asked for favors, whether it's from your colleagues or from your supervisors? If it's always you that's being asked to stay late to do the admissions at the end of the day, or always you who's asked to teach the students or the learners while others get to see interesting patients. What about getting coffee for the team? Another example of a favor. Is it okay or not? So it'd be different if everybody took a turn getting coffee for the team versus if you were always the person who was asked. What about this example? So you're in the OR and the surgeon who is operating grabs your hand or slaps it away as a means of communicating in the operating room. So depending on the circumstances, it's not an ideal form of communication, but say you were about to sever a major artery or to injure a nerve. Perhaps it was the quickest way for the surgeon to stop that from happening, but of course, still not an ideal form of communication that would be permitted in most scenarios outside of an urgent situation. So what about this one, where you're asked a question in front of a group and you don't know the answer? Is that considered bullying? Is that harassment? Again, it depends on the context. I would say that if you're asked a question and you don't know the answer, and then your faculty member or preceptor moves on to the next resident or student, probably not harassment or intimidation. But if then they persist to continue to ask you questions, to berate you, or even to belittle you in front of the group, then that's a more overt example of harassment and intimidation. So any other thoughts before I move to the next slide? Okay. So this is a short video app that I want to show you. So it's of a woman named Yumna Musa, who's a former medical student, and she undertook medical training at the University of Cape Town in South Africa. And so this is a video that she recorded where she describes some of her experiences related to harassment and discrimination during her training. The video is 8 minutes long, so I'll only play part of it, but you'll get the idea. So let me know if you can't hear the audio.
Hi, my name is Yumna Musa, and I want to tell you why I don't want to be a doctor anymore. Last year I worked under a man who sexually harassed me. It wasn't only me, it wasn't always sexual, it was open, and it was every day. Humiliating and degrading lower-ranking doctors is a big part of medical education. So he is an award-winning teacher. I had to say something. I had my phone with me while the hospital management explained that actually there was nothing wrong with my supervisor's behavior. First, the racism.
Are you defining yourself as colored?
Well,
No,
it's
race.
tricky for me.
No, we'll pick one.
I don't want to.
But no, you're saying that this is a racist problem. So you must pick a race, and then we work from there. In the last 2 years, as far as I can see, there have been 16 whites, 43 Indians, 33 blacks, and 10 coloreds, of which the one, I'm going to classify you as colored whether you like it or not. In this diverse group of people, is in your group, he must have experienced the same process, because he's a colored and he's in the Department of
An example of something I mean is to say to a particular black person, you being stupid like a black person. So it's not to all the black people, it's to that person,
Okay.
but it's referring to their race in the insult.
Okay.
And that has happened.
Okay, so it's individualized.
Okay.
Racism is
Okay.
against a particular race.
Yes.
I'm racist. I won't be racist towards every white man in this
Yes.
room.
Otherwise, it's not racist.
It's not racism. No.
It others, if she's
Individualized.
racist, right? Or say, let's use sexual harassment, because sexual harassment, the definition is something that you personally feel uncomfortable with. So if he makes a remark and I'm comfortable with that remark, then it's not sexist.
Friendly
But
banter.
does it have to make every woman that has
Yes.
ever spoken to him
Yes, that's the
uncomfortable?
definition of sexism.
Okay, so I think you get the idea. And so clearly this is not representative of a culture that we want to have in our faculty. But here it was enabled because people were not empowered to speak up. And then even worse, you can hear that these behaviors were normalized and justified. Individualization. I've never really heard that term used in this way before this video. But it's really important that if these types of mistreatment are occurring, that at the very least you speak to someone you trust, whether it's a friend or a peer or a faculty member, just so you can get the support you need for your own wellness. But for us to really be able to stop this type of behavior and keep it out of the culture that we want to create, it'd be really important for these concerns to be raised through the professionalism office or the EDI office or a more formal route, so that we can help if any of you encounter situations like these, and so that we can do so while protecting you and your confidentiality. Okay. Any other comments? Questions? Oh, sorry. Okay, I'll move on. I think we're running shorter on time than I thought, so let me go ahead. So our Faculty of Medicine has a number of policies that come from University of Ottawa centrally that we follow and enforce to prevent harassment and discrimination. So there's policy 67A specifically for harassment and discrimination. There's policy 67B for the prevention of sexual violence and harassment. And these policies are found on the U Ottawa website and define specific behaviors that would constitute any one of these types of mistreatment. And then as a reminder, of course, the Be in the Know website is another resource that can be helpful. But again, if you're unsure or you need guidance, you can always reach out to the EDI office. So I had another case I wanted to go through. Just looking at time, we have about 10 minutes left. Is that right, Janine?
That's correct, yeah.
Okay. And so you know what, in the interest of time, I'm actually going to move on to the closing slides. We had a really good discussion, which I'm very happy about, but I want to make sure you leave here and have tools to know how best to take action against harassment and intimidation. So firstly, when we talk about different actions you can take, there are informal procedures as well as formal ones. And the first one, when talking about informal procedures, is to admit that there's a problem. Because I think often we assume that, it's in our heads, or that if we ignore it, it'll go away. But the truth is that the behavior will continue and possibly get worse if you ignore it. And so one way that you can kind of check yourself to be sure that it's not something that you're imagining or something that you're perhaps taking out to blowing out of proportion, you can make a log of the behaviors that you find concerning, because it helps you to identify a pattern. And it also helps as a mode of documentation if you do decide to report this behavior. If you're comfortable and you have a relationship with the harasser or bully where you're able to speak to them or communicate with them in writing, you may choose to do that to explain what aspect of the behaviors that you found offensive and to describe how it actually has impacted you. And then another approach that's important would be to talk about the situation with someone you trust. So some of the people I mentioned, friends, peers, professors, mentors. If you may even reach out to the EDI office to speak to Dr. Kapur or one of his colleagues to get support. You may be advised to seek counseling for your mental health and well-being, because mistreatment is something that can have significant impacts. And so it would be important that you at least speak to someone in the wellness office to see if there are supports they could offer, or perhaps even speaking to a counselor. The EDI office is another place where you can find resources for support. But depending on the situation, you may feel more comfortable seeking support outside of the Faculty of Medicine, and that's okay too. And so at Central Campus, they have a harassment officer that supports all of the students and learners at University of Ottawa through the Human Rights Office. And so you may want to start with that first, and they can also guide you in terms of finding the right supports. In instances where you seek support through the university or the Faculty of Medicine, your information will be kept confidential. And as this would be as long as you are not at risk of harm and that no one else is similarly at risk of harm. When it comes to formal procedures, you may choose to submit a written complaint, and this can happen through a number of mechanisms. So firstly, there's a professionalism complaint reporting form, which can be submitted anonymously or not. Similarly, there's the 145 evaluation form that you may use if the concerns are specifically related to the teaching and learning environment. And so similarly, you can submit information anonymously through 145, because what happens is that these evaluations are collated and submitted to preceptors and to rotation supervisors without identifying information. However, it's important to note that anytime an anonymous concern is reported, depending on the nature of the report and whether or not there are any collaborating or corroborating reports, we may be limited in our ability to intervene and to follow up if we aren't able to follow up with the complainant to get more information. And also, we're less able to ensure that the complainant is supported in the ways that they need to be supported. So that's one reason why, or those are a few reasons why it may be beneficial not to report anonymously, but to report with your personal information, which will be kept confidential, but will help us in the faculty to better support you. Beyond the university level, there are other formal avenues for complaints that you might be advised to pursue depending on the nature of the issue. So for example, if you have serious concerns about a healthcare provider and their behaviors towards learners or staff or even patients, or if you have concerns about patient safety, you may be advised to report the incident to the governing college. So for example, for a physician, that'd be the CPSO. For nurses, that would be the CNO or CRNO. And then if there's a violation of your human rights based on your protected grounds, it may be appropriate to report officially to the Human Rights Tribunal of Ontario. In extreme circumstances, if there's been an unlawful incident such as threatened or actual violence, assault, or stalking, you may be advised to pursue criminal or civil litigation. But again, this would be an extreme and is not a common occurrence. So again, if you're not sure where to start, the Be in the Know website outlines different steps that you can take and different resources that are available to support you in instances of mistreatment. So again, I hope that this is helpful in giving some tools or at least an idea of the supports that are available and some of the approaches you can take when facing incidents of discrimination or harassment. But of course, if you have any questions, you can reach out to the EDI office for support. And so just a couple of take-home messages that it's very important and necessary to speak out if you're a victim or witness to harassment, discrimination, or intimidation, because if we don't act, it's the same as saying it's okay and allowing these behaviors to grow and to perpetuate within our learning and clinical environments. And so really, we shouldn't be tolerating any form of mistreatment. And in the EDI office and at the faculty, we're here to support you. And so I will stop there. We have a few minutes left. And so I don't know if there are any other questions or comments, and we'll share the slides. I think Janine does share them. And I'm sorry that we ran out of time, but I do really appreciate all the comments that were shared. And so I see one in the chat from Elena. She says, I've seen some allude to the excuse for behavior that is not targeted at one individual, that since only one person expressed discomfort or distress, they're labeled as, sorry, I'm not seeing this. They're labeled as the issue instead of the behavior. How do you suggest someone in this position approach that excuse? Yeah, so it's a really great question. I don't know, Rishi, did you wanna, I've talked a lot, so I don't know if you wanted to tackle it or if I should.
No, that's fine. I'm happy to, and it definitely happens. And I think, you know, going back to that framework around microaggressions, it can be helpful to think through like how important is this to address how, you know, how egregious was the behavior and how, you know, what impact is it having on you or on that person. I think the biggest piece I view is seeking community, right? Seeking support, seeking, you know, we described like numerous levels of intervention, but it doesn't have to be formalized to start. It could be like going to a peer and saying, this happened. What do you think about this? Like, would you have a problem with this? Your program directors are there to support you as you know, with ensuring that the dynamics within your program and the people that you interact with, whether they be allied health, are collegial and safe. And so, you know, it wouldn't be unreasonable. Program directors are checking in regularly, like to have that on, you know, on the list of, you know, this happened to me, and you might still keep it, you might want to keep it confident or anonymous, but just to explore if you know, how it could be addressed in the future if it were to happen again. Those are some of the things that come to mind. Dr. Simpson, I don't know if you have other things.
No, I think that you made some really important points, because it is a community, and it's likely that even though you may be the individual who these comments or behaviors were directed towards, that other individuals who may have witnessed this are also affected. And so, you know, talking to peers can be helpful in that way, peers that you trust, and talking to your program director also is really important, because that is probably one of the most influential individuals when it comes to the culture of a program. And they really do want to be aware when behaviors or mistreatments are occurring, because they want to ensure that the learning environment is safe. So, yeah.
The only other thing I would add to that is, I mean, we know as leaders that there is an underreporting of incidents of harassment, intimidation, and discrimination in our institution and in many institutions, you know. So I think one of the biggest pieces we always speak about when we're talking through some of this is that for something to be, you know, there is the value in informal intervention versus formal. And sometimes you might say this can be addressed informally. We don't always need to go formal. But you know, that we can't typically address things if they aren't brought up. So, you know, it's very difficult for you know, a staff member to be placed on task or for something to be addressed if they aren't given that direct feedback, right? And one thing I learned, you know, just a few years ago was that the idea that leaders and people in positions of power don't realize they're at fault or that they've done something wrong if they don't get feedback. They on it, if it goes unchecked, they actually cognitively think that they're doing okay. Like if they're managing if a manager is managing a group of 10 people and they never get any constructive feedback, their thought is, I'm doing a good job, right? And so we actually have to be working on the breadth of feedback that is sometimes positive, sometimes negative or constructive, to help people grow and you know, even in their leadership roles, if that makes sense.
Yeah, absolutely true. Because I mean, we all have heard that expression, no news is good news. That's not always the case. So really, you know, it's so important for us to be made aware in some way, shape, or form about instances of mistreatment. And yeah, that feedback could come, you know, anonymously or not, or formally or not, but it's just really important for us to have that feedback. Okay, great. Thank you all for being here. And we really appreciate the discussion. So thank you all. And if you have questions, please feel free to reach out to our emails. They're in the slide deck. But yeah, I guess that brings us to the end of the session. Okay, thank you, everyone.
Thank you, Dr. Kapur and Dr. Simpson. Really appreciate it today, and I hope you have a great day.
Hey, thanks, you too. Okay, bye, everyone.
Bye-bye.